Okay, so this video will be of a restorative dentistry happening on tooth 18 and 19. We're going to go ahead and get started. We've already gotten the patient none and we're hopping in. A couple things I want you to be focusing in on is the assistant. She'll be on your right hand side of the screen. She has both the surgical suction and the saliva ejector in her hand, aiding in visualization of the tooth that are being worked on. You can see here that after we had gotten started, patient kept complaining that the tooth was still sensitive to cold. Every now and again this will happen, so you just go ahead and do another block. If you've never tasted anesthetic before, it tastes extremely bitter, very gross. So immediately after I'm done, you'll see the assistant, before the patient closes, go in, rinse out the area. Great. And then we're going right back in with another block. Again, we're blocking again, had some sensitivity. It happens. This is a perfect time to go ahead and confirm that you do like your setup, that you have everything that you're going to be doing for that procedure. If there isn't something that you have, depending on the office, either call out to one of your other teammates to help you out, or let the doctor know, hey, that you're missing whatever the item is. So let's see. So we're finishing up the block. Again, the assistant's getting ready to come right back in. You see, before she closes, she's already ready. She's in there, doing an awesome job. Rinsing out. Another one of the job roles of a dental assistant is just, again, making sure the patient is comfortable. So staying on top of the suction, staying on top of preventing any bad taste, products that have bad taste going into the mouth. And there you go. One last rinse. This is actually the patient's very first time coming to the dentist, so she was already pretty nervous. It's another thing that separates a good dental assistant from a great dental assistant is, again, being able to affirm the patient, make them feel comfortable, make them feel safe. And we'll see here. So these fillings are on the patient's lower left-hand side. If it were the case where we were doing the lower right-hand side for the patient, the roles would be reversed. I would be retracting the cheek, or the doctor would be retracting the cheek, and then the assistant would be retracting the tongue. So you see here, we're prepping away. Patient was able to do the majority of the cavity removal at her regular or original state as far as anesthetic goes. So now she's just really profoundly numb while we do the final cleanup of the prep, making sure it looks ideal. There you go. Great picture where you can see both the high volume doing its job and the saliva ejector. You see there's not a lot of overspray or dental aerosols happening here. Again, that high volume, when it's done properly, does a good job at minimizing everything. So again, making sure the patient's still staying dry. You'll notice too that patients that are fully profoundly numb have a tendency to believe that they are more full of saliva than others will. You see we got some nice preps. Small, conservative. So here's an important little handoff here. You don't want your doctor to be reaching for the tools that you should be handing him. That pretty much defeats the purpose of you being there chairside with him. Another good portion of this video is that it's showing, yes, you're still in there assisting the dentist, and yes, you're still doing your job and your responsibilities, but it's also important to be having fun while you're at work. Patients can feel that energy, can feel the vibe, that you're having fun, that you know your stuff, that you're comfortable. That's important. So you see here we just etched, water spraying everywhere. Double check that you got all the etch out. That's really important. You don't ever want to leave behind etch. Then when the doctor comes in, if he sees it, either he may see it or he may not see it, so just definitely do a really good job making sure that etch is out of there. Here we're using a desensitizer agent. This is not for every filling. Just felt like doing it for most of mine. I do like to do it and go ahead. I like my micro brushes, which are the little pink sticks that she's handing off. I like mine pre-curled or pre-bent. I haven't worked with this assistant for a while, so doesn't quite know how I like it, but that's okay. I don't mind going in there and bending it myself. There we go. At my office, efficiency is king. So if that means I have to light cure while my assistant grabs something else for the next step, absolutely hand off the light. Not every office is like that. You just have to figure out what your office flow is like and join that culture, whatever that is. So here, drying off the bond. You want to get any solvents out of that bond and make a nice thin layer with no moisture. You can light cure that thin layer and then hand off whatever composite or amalgam system that you're using. So by now you should know etch, bond, fill, repeat. And knowing when it is an appropriate time to light cure. You never, ever, ever want moisture or saliva or water to be in the area where the dentist is filling up that tooth. So have that air and water handy. You see it's right there on her tray. It's close. So that if we have to blow out that tooth, it's ready. Excuse me. All right. So handing off the instrument to compact and clean up and shape the composite. Once the doctor feels that it's comfortable or where they like it, you'll either get the cue to wipe the instrument, so have those 2x2s ready, or it's time to light cure. Another important thing is sometimes you can go ahead and damp that 2x2 with alcohol. Alcohol is going to help remove any remaining composite off the instruments. You want to do this for any filling, especially for crown cement. You want to be using that alcohol to wipe it fully clean before you autoclave the instruments. There it is. There's another handoff. I like to still do one full cycle at the very end. Even though I did layers or increments and light cured in between each layer, I still, at the very end, I like to do one final time. You can't over cure, but you can absolutely under cure. So here we are. A little moisture or saliva had built up in that tooth back on 18, so I'm just having her air dry. And I'm looking and telling her, hey, I think I still see a little moisture back there. If you could go back in. So now the tooth is dry. I have my composite because she already handed it to us. We're moving efficiently, filling it up. All right, nice handoff. We can see what we're doing. There we go. Again, she was going to go in and light cure, but I was okay with it. I'll just do it. We can keep the flow going. It was working fine. Doing great. So this is how it'll look as a good assistant, right? Handing off is efficient. You know what's next. Things that you never want to see out of your doctor is if he's reaching over you to grab something else, or instruments that still have composite on them, have blood on them. Those are little things that after a while can add up against you. So make sure the instruments are clean. Make sure you know what the steps are happening next, and keep it rolling. You see here we have the articulating paper. And here we're going to go ahead and have the patient tap, 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 and grind around. So I'm using the cotton forceps or tweezers, as they sometimes are called, in my office. There are articulating paper holders. So again, depending on the office, use whatever is appropriate there. Here we're just cleaning up the bite, make sure that it's clean, it looks nice, it's tidy, looks pretty. But look at that retraction. Beautiful. We can see perfectly straight into that tooth. She's doing awesome on just retracting. And this is just with one. She doesn't have the saliva ejector in there right now. She can, but clearly she's doing a good enough job with just the high volume. So we're going back and forth. Some offices like to have the assistants do this step. Nothing critical. All you're doing is just placing the articulating paper over the teeth that were prepared and filled. And then the doctor will come back in, look and see, and then he or she will make the adjustments. There we go, coming in to polish everything up. Really proud of this patient. Like I said, this is her first time coming in with us, and she did absolutely fantastic. You see here again that isolation. Now she's back to using two. Here's just a still shot, depending on the office. Some like pictures, some don't do too many pictures. So there you go. Hope you guys enjoyed the video, and I hope you guys have a great day. Couple big takeaways again is I want you guys to have proper isolation, either using two hands or just one instrument, using the appropriate suction at the appropriate time, knowing when to rinse and when to keep things dry, knowing what comes next. In a restorative setting, it's going to be drill, etch, bond. Maybe there might be a step for the desensitizer before the bond, and then go ahead and air thin that down, light cure, and begin the filling process. So I hope you guys have a great day. Keep on studying hard, and we'll see you soon.